Good evening, everyone. Welcome to our session. And just to give you notice that we will be live online, so put on the best look. So we welcome you to our session right now. We would like to acknowledge and thank the traditional custodians of the land on which we meet today, and we recognize the significance of the Birarung to traditional owners as a life source and a meeting place. We pay respect to the Bunerong Bung Wurrung and Wurundjeri Woi Wurrung people of the Eastern Kulin Nation, and we recognize their continued connection to the land and the waters of this beautiful place. We acknowledge that they never ceded sovereignty, and we pay respect to the elders of the community and extend our recognition to their descendants. My name is Bani Sapondi. I am the new CEO of Vocal, and I welcome you to the session. I'm going to give you a brief overview of our event, then we are going to allow our presenters to take the stage. After that, we are going to have the questions, and we are also going to have our two members of parliament from Kenya who are going to give us a perspective on political leadership when it comes to supporting people who use drugs. So harm reduction in Africa began around 2005-2006. And the first countries that began harm reduction by record is Mauritius. And a lot of it began ad hoc by civil society. Then government took on as the programs went on. Since then, we have seen Kenya, we have seen Tanzania, we have seen Burundi, we have seen South Africa, we have seen Uganda, we have seen Ghana, we have seen Lebanon, and maybe some countries are just beginning come on board. But even though we implement this, there are gains and challenges. We still see a lot of poverty within our people, meaning the harm reduction programs are implemented in scarce environments. There's very little funding still. We have peer groups are not being supported. We have the whole continuum of harm reduction just being implemented halfway, such that you have the biomedical not going hand in hand with the behavioral aspect. Because of that, we have seen a lot of challenges. But even in these challenges, there are people who have gone out of their way to make services available for people who use drugs in Africa. So we are going to listen to Richard, who is the chair of African PUD. And Africa PUD is the network of people who use drugs in Africa. But before Richard comes, let me just introduce the panel. We have Wanjangure from Uhai Ashri. We have Julie from South Africa. Then we have Wambui Karanja from Vocal Kenya. And we have Richard Ninina Hazwe from Burundi, but he sits in Dar es Salaam, Tanzania. So we are going to invite Richard to tell us briefly his perspective from African PUD. Richard Ninina Hazwe is the coordinator of the African Network of People Who Use Drugs, which was registered in 2016. He's the co-founder of BAPUD, Burundi Association of People Who Use Drugs. After BAPUD was registered as an NGO, he took part in the first study of drug users in Burundi. This study put a new face on drug use and seroprevalence, representations for people who use drugs at the CCM in Burundi. He led a successful advocacy for harm reduction inscription in the National Strategic Plan 2021-2023, funded by Global Fund. He endowed Africa PUD with its first strategic plan and its first community-led study on human rights violation on people who use drugs during COVID 2019. Please welcome Richard.
Thank you, Banis. I would like first of all to thank everyone here for the floor. My thanks to Elton John Foundation, Vocal IDPC, for letting us give remarks during that short conversation. I'm sorry I didn't prepare any presentation because I want to make it as a conversation, not an academic things. So first of all, I would like to give you a short overview of African PUD. African PUD is an African network of people who use drugs under the umbrella of International Network of People Who Use Drugs. We have 4 objectives. So first of all, it was to promote evidence-based research to push for drug policy. We promote also harm reduction, and we have a link with institutions in the same way with us. And African PUD, we are based in Tanzania, and we cover now 22 countries in sub-Saharan African. And our membership is one-fold organization member. We talking about drug policy, the involvement of people with drugs. I think this is a must, and it has been proved that good policies are led by people with drugs. This is a current example in South Africa, where people with drugs has made good job about drug policy, and reflecting on that is development is a must, as the international guidelines on drug policies by UNAIDS define it. We have to call state members to move all societal barriers to drug use, because even we say we legalize the drug use, there is that look from the society, from Africa, and say that those guys they are using drugs. This is a hard way run by criminalization. So the government have to remove those barriers to allow us, as evidence show us, to be in part of the trend of drug policy. Talking about what's working in Africa and what are the challenges in drug policy. Yes, there are some part in Africa where drug policies are good. I can mention South Africa. I can mention Ghana. We have seen good policies change. We are also confident that we have now 22 networks registered in different countries. So the first step that we register networks of people with drugs, it's a movement which is starting, but we still have people who are sentenced to jail because they are using drug, or because they have something they are using to use the drugs. In some countries, you can be jailed because you have just a Rizla, a rolling paper, because you have a syringe in your pocket. You don't have the drug, but you have that kind of thing you are going to use. So we need to, yes, of course, there's the policies aim to promote the harm reduction, but why harm reduction, not human right? Why I'm getting services of harm reduction but still jailed because I have only syringe, because I have only rolling paper? And where it is going good, we need to strengthen those initiatives. There are small part where it's going well. I mentioned South Africa and Ghana, but also in East Africa we are starting to see good also initiatives talking about women who use drugs. We've seen a network of women who use drugs. We've seen people working on women who use drugs. We have to strengthen those initiatives, and where we don't have them, put more strength on it. So we need more fund to conduct a good drug policies reforms, because these are what we call procedures. It's not something, and we have challenges, in Africa. For instance, the case of MPs, they can serve for the first term, but in the other term, there will be new ones. So we have also to deal with those changes among our leaders. And I would like to end my conversation by this. I didn't want to be so long. I think we were going to continue our discussion with other presentation, and questions will reveal what maybe I didn't say. Thank you.
Thank you, Richard, for letting us know that in the course of implementing harm reduction, there are so many challenges. We are talking about criminalizing. We are talking about arresting people who are going to access the harm reduction commodities. We are talking about lacking of funds or poverty. We talk about rings of drug cartels, taking hostage of drug users that are there, and gangs, of course, of South Africa we cannot forget, and then we are talking about corruption. So next, we are going to hear from Julie. Julie is a human rights, healthcare, and harm reduction consultant from South Africa with special focus on women who use drugs. Julie holds an executive director position for Stand Action, who operate in rural areas in South Africa. Stand Action is a steering committee. She is a steering committee member for the World Assembly for Community Action on Alcohol and consults to several local and international funded projects through the Global Fund, UNODC, Open Society Foundation and Sanpud, Robert Carr Foundation, and TB HIV Care. Please give it up to Julie.
I'm going to stand up there. Control the slides. Okay, good evening, everybody. It's lovely to have so many people here at this time. I know it's late in the day and everyone needs a drink, so thank you for being here still to listen to this presentation. I'll try to keep it brief. So I've been very privileged, is it up? Yeah, to have this project funded through the Elton John AIDS Foundation. Primarily, what we're hoping to be doing is to capacitate and train healthcare workers on how to work better with pregnant women who use drugs, and also to establish an evidence-based toolkit, which can be rolled out quite broadly. We're hoping to roll it out more broadly around South Africa. Initially, we will be just doing it, piloting it in the Western Cape. And this toolkit, besides providing evidence-based information on the different drugs that are common in the Western Cape, will also be looking at their impact on the development of the fetus and uterus. Okay, so why do we need this project? Why was it important? So currently there's no accurate data around the number of pregnant women in South Africa who use drugs. Women who use drugs are frequently stigmatized and in some instances even turned away from healthcare facilities, particularly in rural areas when they are trying to access perinatal services. Another concern we have there is because in rural South Africa, communities and villages are very small. A lot of people know each other. Well, in fact, most people know each other. And so if there is a woman who is pregnant and using drugs, she may refrain from going to healthcare services because she doesn't want people in her village to become aware of the fact that she's using drugs. Healthcare workers in South Africa have limited knowledge, unfortunately, with regards to evidence-based information on substance use. In the nursing training in South Africa, there is only a very small segment of the training dedicated to substance use information. And there are no guidelines or toolkits available to support healthcare workers in this field that are specific to the South African context. And there are also very few funded harm reduction services in South Africa, and currently there is not one harm reduction service available to people in rural South Africa. Okay, another problem we have, the Western Cape has the highest rate of fetal alcohol spectrum disorders in the world. Currently about 111 per 1,000 population born are born with fetal alcohol spectrum disorder. And the Western Cape has as high as 290. So that it's a massive amount of children that are born experiencing the fetal alcohol spectrum disorders. And beyond, what I should have actually written there is that there are several factors beyond poverty and socioeconomic circumstances that impact this in South Africa. One being the DOP system, and for those who are not aware, that was something that was prevalent in the apartheid era, where people were part paid with alcohol. So specifically for those that were working on farms, on wine farms, or in the brewery industry, part of their pay during that time was actually paid with alcohol, which that has been disbanded, but unfortunately in rural areas it does still take place. Stigma and discrimination when women are trying to access care. Shebeens, so again, those that don't know, these were normally established these were established in the 1950s as organized resistance to apartheid. They were places where people could gather, and there was a lot of campaigning that took place, and that was originated from being in shebeens. These were open late and operated outside of legislature, and that is still ongoing. So they are located throughout South Africa, including in townships and rural regions, and very little legislature is there to kind of contain. So they will operate and sell alcohol throughout the night, on weekends, public holidays, where other more legislated, for instance, liquor outlets are not available. And then obviously affordable and accessibility. So people, again, that I mentioned working on wine farms and in the brewery industry, they have easy access to alcohol at cheaper prices. And we also have in South Africa what's known as a court. I'm not sure how prevalent that is in other areas around the world, which is a unit size of beer. So for those that normally beers are sold in bottles in kind of 330, 340 mils, sometimes a pint of 500. In South Africa, a quart is between 1.1 and 1.3 litres of alcohol. So there are a lot of factors that influence why drinking is prevalent in rural areas. And then obviously having a lack of treatment facilities, including harm reduction service provision for pregnant women who use drugs. So these are the main reasons we really wanted to develop this toolkit and this training. These were just some photos I thought I'd share with you of the women I had focus groups with and interviewed before we started working on the toolkit, just to make sure that what we were talking to was relevant to the context of how they were living. You can see this was a classroom that I was able to borrow at a creche for the day. And the woman, obviously there is no childcare facilities in rural areas. So I just invited the ladies to come and join bring their children along. So what will our project do? In July of last year, our education minister, Angie Mocheka, she mentioned that there were recorded 90,000 South African school-going girls between the age of 10 and 19 who had had babies between April 21 and March 2022. So we're wanting to make sure that there is some level of education that will reach school-going girls through healthcare services. Healthcare professionals, including nurses, community healthcare workers, AEST counsellors, there are the HIV and AIDS counsellors, and others will be trained and capacitated on the latest evidence-based information concerning pregnancy and substance use. After that, we will be doing case studies with 3 women, and we will follow them throughout the duration of their pregnancy, just seeing whether the nurses and healthcare staff that we had trained, whether their levels of service had differed once they'd had training through their pregnancy. And then we'll also be carrying out an ongoing monitoring and evaluation process, which will run concurrently to evaluate if the toolkit is actually helpful for the healthcare workers themselves. And we will look at ways in which we can strengthen that or better the content. And once that pilot project is completed in the Western Cape, we'll be rolling that out, hopefully more broadly in 2024. Quick summary of what we've done to date. So we've done 2 focus groups. We've documented the baseline data of the area. We've engaged with Department of Health at district and provincial level. We've carried out one-on-one engagements with the leads of 3 provincial healthcare clinics that provide antenatal services to pregnant women, just to establish what their concerns were and the issues that they were having in the areas. We've engaged with the National Harm Reduction Coalition, who will collaborate with us on the development of the harm reduction toolkit for pregnant women to ensure it aligns with global best practice. And we have now drafted the first toolkit. Training on that will take place next week, so I literally get back to Cape Town on Friday and start training on Monday or Tuesday. And yeah, once that's done, we'll be taking some further information from the healthcare workers and rework that back into the toolkit. And that's where we are at the moment. And yeah, just to close on some photographs from the ongoing engagements that we've done. You'll see me standing in the top with one of the ladies that is currently pregnant. She's given us some great insight into current experiences that she's had at public healthcare services, which haven't been great. And then just a picture at the bottom, those are the prams, and you can see there's one modified wheelchair there that someone's having to use as a pram. And I thought that was just quite a nice kind of demonstration that in the rural areas with lack of resources, they really try to do whatever they can to meet the needs. Yeah, thank you very much.
Thank you very much, Julie, for the wonderful presentation. Next, you're going to have Wanja Ngure to make a presentation to us. Wanja is a Kenyan feminist and a human rights activist based in Nairobi. She has a degree in social work and a master's degree in human rights. She has over 19 years of experience working with marginalized key and vulnerable population in Eastern and Southern Africa countries. She's currently the program manager grant making at Uhai AEST. Uhai AEST is an indigenous grant maker that supports civil society organizing for and by sex workers and sexual and gender minorities. In the last 3 years, they have also been deliberately incorporating funding on harm reduction in Burundi and the DRC, the Democratic Republic of Congo, Ethiopia, Kenya, Rwanda, Tanzania, and Uganda, with flexible and accessible grants, capacity support for Pan-African advocacy and research and documentation. She draws her inspiration from hope, love, and the strength which comes from communities that she serves. She believes that everything in life has a solution to it, and it is our noble duty as a humanity to figure it out. Her charisma and positive action vibe has led to her work tirelessly in activism, specifically advocating for the lasting change for marginalized and key vulnerable communities. Welcome, Wanja.
Good evening, everyone. This is quite a scary space. Yeah, but we have to do what we need to do. And thanks so much, Ejaf, thanks, Voco, and thanks everyone for coming in here to listen to these beautiful presentations that are coming from these beautiful presenters. I was actually asked to present on quite an interesting topic that is key to my heart, intersectionality. And my questions were, why do we need an intersectional approach to harm reduction? As Bernice has said, I come from Uhai AEST. Uhai AEST is a grant maker. It's an indigenous grant maker that funds seven countries in Eastern Africa. We work with sex workers, we work with LGBTIQ folks, and the last 3 years, we have deliberately incorporated the aspect of drug use, because from our perspective, we believe drug use is not an identity. Drug use is a vulnerability that cuts across various populations. And so that is key to our grant making. And yeah, so am I the one who's supposed to gosh, this technology, what? How does this thing even work?
Just pop it on the side.
Yeah. Do thank you very much.
There we go.
Participatory grant making is one thing that we work with. So I would ask for participatory presentation right now. So help me in learning the slides. So my presentation is based on two things: intersectional approaches in policy making and policy advocacy, as well as in grant making for harm reduction. What is intersectionality? And according to the people who coined intersectionality, we have Kibari Crenshaw, who actually believes that if we do not use intersectionality, most vulnerable populations are going to fall through. They are going to fall through the cracks, and that is what we are actually seeing in most of the work that we do. And a feminist by the name of Audre Lorde, actually has also said that there's no one thing which is a single issue struggle, because we do not live single issues lives. Next slide. Then in that case, what does the concept of intersectionality, what does it talk about? And one of the things I actually also want to mention before even I move to the concept of intersectionality is that this is quite a buzzword of late, and it is not, which is beautiful, but it's a buzzword that probably people are just coming into understanding what really intersectionality is, and it is now that the awareness is growing. So what does it articulate? It articulates, analyze the lived realities of those who experience multiple inequalities. And as I had said earlier, it doesn't just look at one vulnerability, but it looks at various vulnerabilities that are structured by the society or that people live with, and how they interpret to affect people's rights. And so intersectionality recognizes that people's lives are shaped by identities, their relationship, and social factors. And all these, once they combine, they create intersecting forms of privileges. They also create structures of power. They inform how laws and policies are made, and they also inform even how governments and program makers address these issues. And also, it also brings in about how oppression actually comes about, and how also discrimination, stigma and discrimination, it actually manifests itself. Move to the next slide. Thank you. So intersectional approach, that means that analysts, they definitely do not give higher status to any social category, inequality, or experience. So once you are using intersectionality in policy development, if you are talking about, I give examples with the populations that we work with. If you are working with a lesbian woman, so what does intersectionality mean for that lesbian woman? Because beside the fact that she is sexually attracted to other women, there are so many other things that compound to make that lesbian woman. She would be a lesbian woman who is a sex worker, and don't bring in a question of how she's a sex worker, because sex work is trade, but she could also be a lesbian sex worker who uses drugs. So how do we make sure that even as we are addressing, or we are making policies, that we are able to address the issues of this lesbian woman who has all these compounding vulnerabilities, to ensure then that that woman does not suffer stigma and discrimination because her factors pushes her to the periphery. And then in the other thing that is an approach that would help us in doing policy advocacy, it's analyzing the power dynamics. And how we do it as UHAI is ensuring that these populations are the populations who are defining what needs to be done. We are not the people on the table. We are not the people with the lived realities. So we actually get to the people with the lived realities. We get them to do the work right from conceptualization. There is one concept that has continued, and especially in the donor world, that our populations I'm talking about, they do not have capacity, but they have the capacity. They have the knowledge, they have the lived realities. So how do we analyze these power dynamics to make sure that these people actually get to define the policies, get to define what really works for them? And definitely also, it's also important to also look at some of the historical injustices and contemporary structures that define the lived realities of these people. We are talking about homophobia. We are talking about patriarchy. We are talking about ableism. We are talking about so many other things that structures the society and that pushes our communities to be oppressed. So then, in terms of, let's move to the next slide. So in terms of grant making, one of the things that that is our driving factor at UHAI is participatory grant making. We are actually a participatory grant maker. And so what that means is that we try as much as possible to help to break the silos that comes with funding. And what does that mean is Uhai is actually a non-thematic fadder. What non-thematic fading for us means is that once a concept comes to us, we don't like necessarily say, oh, this deals with this. We actually look at what is that population trying to address, and if we have funding, then definitely we figure out, we work out with them and help them in and fund them. So we try as much, and we also move with this concept even to other donors, try to say that why don't we give communities funding that is flexible, funding that will be able to help them deal with all the issues that are compounding, other than just address one issue that is that we think as fathers that is what is affecting them. So from my experience, funding for PUD and sexual and gender minorities are among the most siloed funding streams when it comes to human rights philanthropy. And so to help us address and legislate on issues in their complexity and address the root causes, we would definitely want to bring in about participatory participatory approaches, get the people with the lived realities on the table to move the resources, to make the decision of how they would want those resources to be moved. And this does not just apply into the funding, it also goes back to policy. When we are talking about policy, at what point do we actually bring the people with the lived realities, and I mean people with all the sectors, if it's a person who uses drugs, who is a woman, who has disability, how do we make sure that all these vulnerabilities are taken into perspective when we are even developing these kind of policies? And so what I'm saying here is that the siloed funding, in most cases, is not all the time that they address issues. They address all issues that affect people who use drugs. And so that is why it's important that we address the component. Oh, my time, gosh. Yes. Bad news, thank you very much. Next slide. Yeah, that addresses the aspect of intersectionality. I'm almost finished. I won't talk much. So we probably would want to move to the next slide because of time. Yes. So what are some of the challenges in policy implementation? Okay. Yeah. So one of the things that we have found as a grant maker as challenges, and especially when it comes to programming and policy, and policy is the siloed way of how funding moves. And we are trying as much to talk to our colleagues, our other donors, whether public, private philanthropists, and also even bilateral donors, to incorporate aspect of flexible funding so that then funders are able, communities are able to actually address issues and address them with the various vulnerabilities that comes with that. And this also, it moves across all the things, even when it comes to programming and policy. And how do we ensure, I know this year we are actually talking about universal health coverage. We'll be moving to New York in September to look at the whole aspect of universal health coverage. And this question keeps coming into my mind, like the last 5 years, what is this that we have achieved? We are finding criminalization happening each and every day because we are not talking to our communities. We are not getting the communities on our table. I'm very happy that my government is here because policies are being made by governments in parliament that are actually affecting the same people that we've said, that we declared in New York that we are not going to leave behind. Right now, as we speak, there is a law. There is a bill in Parliament to be tabled on legislating LGBTIQ folks in Kenya. It's happening in Uganda. Tanzania, a gay man has been arrested and jailed for 30 years just because of loving another person. Burundi, we still have 17 community members in detention just because they were arrested addressing HIV issues on men who have sex with men. So these are the issues that our communities or people who use drugs our sex workers, the LGBTIQ folks are going through. And what is funny is that these laws that are being defined, or rather that are being developed, they are being developed from a moralistic aspect, thinking that they're actually just going to affect those populations. But in reality, because of how our world has issues overlap, they are actually going to affect the same general population. They are going to affect the economies of our countries. They are going to affect so many other things. So how do we address, and this one I'm also talking to the donors in the room, that how do we actually ensure that we give more funding to these populations in a way that is not siloed, so that they are able, they get empowered. Money is power, I move with that card all the time. So that they get power to be able to push. They get power to learn, to get to move away from their countries in case they are being arrested. And being able to actually to get to, even at the international level, to lobby for this. And then we also need the other thing about funding that is not siloed, but funding that looks at work from an intersectional angle. It strengthens our communities from competition. Because then sex workers are not saying, oh, we just want to work as sex workers. People who use drugs, they just don't want to work, but they will work together, and they'll be able to move, they'll be able to change the systems of oppression, because there is strength in solidarity. And that is our theme for this workshop, or rather for this conference. So let's move from the boardroom. Let's move with this trend in solidarity in how we do our programming for our populations, and even in how we fund our population. Thank you so much. I would have talked more, but I'm told my time is over.
Wanja, I promise next time you take more time, I'll fine you. Next, we are going to have Wambui Karanja present to us. Wambui Karanja is an advocate of the High Court of Kenya with over 7 years of experience in the legal field. She has unwavering passion for advancing human rights with a strong focus on advocating for harm reduction policies and programs. She currently leads the Vocal Kenya Policy Advocacy Project. Her legal expertise and commitment to social justice have driven her to write research papers and legal opinion on laws in Kenya and Tanzania as well, as working on projects with OSF, AJAF, and HRI. Let's welcome Wambui.
So good evening, everyone. I also didn't make a presentation like Richard, because I wanted this to be more conversational. So I'll just read from my notes. What I was asked to present on was how can communities and civil society work together in the policy formulation process. So I've been working on that field specifically, and I'll just speak about the work that I've been doing, and I'll make it very, very informal. So there are 3 things that I'm going to mention, and then I'll just break them down so that I don't take Bernice's time and be fined. So number 1 is consultation and participation. We want the community and the CSOs obviously to have consultations and participation. If the community doesn't give their views on what they think the laws should look like, as Wanja talked about, then we're not going to have laws that are conclusive or show exactly what the society is talking about, right? So on consultation and participation, I would say the community, policymakers, and I'm thankful to have our policymakers here today, and service providers. For people who use drugs, stakeholders such as police and other health service providers are very important for us to collect information from. For the second thing, we're talking about advocacy. After this is the lobbying and the public campaigns and the media outreach, so that we can get the laws that we've created and the input that we've gotten from the people out to the public, just to have everybody's opinion. And then after that, we have capacity building. So we have training programs and workshops, which we do this at Vocal already, and activities that enable communities and CSOs to better participate in the policy formulation process. Why do we do this? We do this to ensure that policies are informed by the experiences and perspectives of people who use drugs, and that they are effective in addressing the needs of concerns of the community. So obviously the community has the expertise and the knowledge. They have these lived experiences. So when we're asking for input from them, we know exactly what we're trying to collect, and they know exactly what they want to see in the laws. Representation and advocacy from the community. We have coordinated efforts. So collaboration creates coordinated efforts that are more effective in achieving policy objectives. And then obviously human rights and social justice. So working together helps to ensure that policies are based on principles of human rights and social justice, and they don't perpetuate harm and discrimination, which is happening a lot in the PWD, and I would just say key population as well. So to end this, I think I've kept my time. It's important to, one just said that money is power. I would say money and laws are power, and they work together and they go together. Because if you have money and the laws are still making something criminal, there's some of the things that you still can't do. So money and laws go together, and I say it's important to pass the right laws for our society and that reflect who we are. Thank you.
Next, you're going to a very interesting session where we are going to have, we are blessed to have 2 sitting Kenya members of parliament with us, and we are going to give them a chance just to tell us more about political leadership in harm reduction in Africa, and specifically in Kenya. But before we do that, we're just going to have a brief summary from our presenters. Richard talked about a community perspective on the challenges facing harm reduction in Kenya today. Mentioned a lot of criminalization, drug users being arrested, just because you're a user, not because you're found in possession. Julie outlined the programmatic aspect of working with women who use drugs in South Africa. She outlined how the program has been implemented, some of the challenges and experiences. And Wanja shared with us the intersectionality debate and why we need all communities on the table, not just on board, on the table. And Wamboi just told us you cannot have money without power. You need both. So pack your questions. And as you do that, I'm going to invite the Honorable Sabina Wanjiru Chege. She's a sitting member of parliament. And in the former parliament, she was the chair of the Committee of Health. And she helped pass several health bills. She's going to talk to us about providing political leadership and supporting civil society and people who use drugs. We want an Africa perspective, but she'll probably be specific to Kenya. Karibu, Mheshimiwa. Mheshimiwa is a word in Swahili which means honorable. Clap for my MP. Harder.
Thank you very much. Good evening. Good evening. Good evening. Yeah, you know, sometimes there's confusion of time. It's actually 10 a.m. back home, so I find it a little bit confusing with the timing. First and foremost is to thank all of you for availing yourself and having this time to come and have this very important discussion. As you've been told, I'm a second-time member of parliament. I've served the National Assembly of Kenya for the last 10 years. And the first 5 years, I chaired the Education Committee at the National Assembly. And last term, I chaired the Health Committee at the National Assembly. I was able to interact with the majority of Kenyans and maybe a few other people abroad on harm reduction. And I'm proud to say that tonight I am one of the few legislators who are champions or the voice on harm reduction. And so I almost became the Deputy President of the Republic of Kenya, almost. Yes. So I didn't go for any competitive position, but I was nominated by my party, again, to serve at the National Assembly. Though I am serving in Agricultural Committee now, I am also seated as a member of the Powers and Privileges Committee at the National Assembly, but I'm glad that I'm back here to support a good cause. I happened to listen to the lady from South Africa, on her experience, which was very helpful. And it just made me think back about home and a few things that we tried to do in the health committee last time on the universal health coverage, and especially to make sure that we have our women, especially pregnant women, access to proper health care. We started a program called Linda Mama, where the financing was fully done by the government, and those are some of the experiences maybe Kenyan can share with you, the rest of you, where we have put money so that it doesn't discriminate. Any woman who gets pregnant, they have access to go for clinic, they have access to actually get proper health care until delivery. By the time I was exiting the health committee, we were trying to see whether we can push the period after up to maybe around 1 year for financing. We also worked on the universal health coverage bill, where we were looking at access, affordability, and quality of health care across the board in the Republic of Kenya. But one of the challenges we found along the way was, especially with the young people, the courage even to go to hospital, or even to go and ask for help. That was one of the main challenges that we encountered, and we're trying to look at the programs that can be attractive to the young people, that can encourage them to actually go and ask for help. Our parliament is quite interesting, and I have my colleague who is here, and especially when we come to the topic that Wanja was raising about involving everybody. You call it intersectionality. It's quite a very sensitive, based on the culture and where we come from and understanding. And I think last week I followed quietly on one of our pages as members of parliament, as Honorable Passaris was trying to fight for the rights of LGBTQ. And she got fired up. She was called all sorts of names, and she was called demon, devil, everything. And she said, you can call me whatever you want to call me, but I'll stand for their rights. So let's appreciate Honorable Passaris. She didn't know I was following. I normally don't talk much on that page, when you're dealing with politicians. And I had my own equal share of my party trying to... by the way, I'm also the deputy minority whip for now, before they kick me out. Her party is trying to get my position, so I'm fighting. And so I left Kenya when I was, the fight were on very high notes, trying to defend my position. I came in nominated by my party, Jubilee, but we are also in a coalition called Azimio, and they're also doing a few things that I don't believe in. And so sometimes, when you decide that you have a right of association, it also becomes very tricky for the politicians. So it's not also easy, where we know that every human being has a right, freedom of expression, right of association, but it's easier said than done. We have laws in Kenya, and we have set good laws, but the implementation, that's where we get the challenge, because we are not the implementers, we are lawmakers. We have tried. There was a bill that we worked on last parliament on the narcotics, use of drugs, and the whole discussion was, how do you treat the person who is a peddler and the drug user? And I've been one of the chief campaigners saying we have our national, they coordinate the information against drugs abuse. It's called NACADA in my country, which is anchored at the Ministry of Interior. And my big fight, which is something that we are picking up with Parliament, and we started it last Parliament, is to make sure that we move that department from Interior to the Ministry of Health, because I'm a strong believer that the people who are using drugs are not criminals, but they have a health problem that they need to be assisted and not to be criminalized. And one of the situations that we have seen in Kenya is that a few people, or a section of people who would be arrested might be using marijuana. Then they go to prison, and they might not afford, to get the fines that are very heavy imposed on them. Then they'll end up using the hard drugs, because then they have more access. And so for me, is to actually urge ourselves, especially the legislatures, we look at our laws to see how we can be able to separate the two. How are we able to make it a health issue? How are we able to support? And finally is on we are the lawmakers, and you're the ones who allocate money. I've had the issue of money coming in, and I know Africans, we heavily depend on donors. I want to urge all of us, and especially when there are these new concepts that are not embraced, sometimes it becomes very difficult for us to actually go and ask for votes. If you say you are asking for votes to support a section that is not well understood, you're almost 100% sure that you'll not get the money. Or if you allocate money, it goes to the main plenary in the whole house, it is going to be removed. So I want to recommend the donors who have been supporting, let's do more, but also on our side, we'll try and put as much money as possible. And in our parliament now, we are working on our new budget for the coming year. So we'll see how we work with the Committee of Health. I'm still their friend. I'm still a very big supporter and huge supporter, and see how we can be able to work on that. And I'm sure our honorable member, Esther, will talk about a bill that is coming up in Parliament. We'll see how we look at the existing laws to enhance them so that we are able to gain more and not raise a lot of hits amongst our colleagues. Sometimes you may have a very nice idea, but sometimes if people don't understand it, they can just kill it even before it gets to the floor of the house. So for me, it's just to thank all of you. I remain a champion. I still feel that the issue of harm reduction should be taken inside our hearts. It's no longer, work as usual or just making a law for the sake of law. But we really need to really understand the concept and have as many champions as possible who can be able to support our cause. Have a good evening. I thank you for the opportunity.
Thank you, Madam MP. Next, I want to call upon Honorable Esther Passaris, who is the women rep for Nairobi. Karibu, Mheshimiwa.
Good evening. Allow me to acknowledge the traditional custodians of the land on which we meet today, and to pay respect to elders past, present, and emerging. I also extend that respect to Aboriginal and/or Torres Strait Islanders peoples who are joining us here today. My name is Esther Passaris. I'm serving a second term in Parliament. I'm a member of Unite. I'm the chapter chair for Eastern and Southern Africa, and I'm also a member of the Pan-African Parliament. I was in the Health Committee with my then chair, Sabina Chege, in the last Parliament. In this Parliament, I'm in Housing and Lands, and in Pan-African Parliament, I'm in the Rural Economy for Agriculture, Natural Resources, and Climate Change. Now, as Sabina mentioned, I am bringing a bill to the House with the support of Vocal on harm reduction. Now, how did I get to know about harm reduction? I mean, before, when I was just a citizen, I had no idea what it was. And yesterday, I texted a friend to explain to her that I'm in Melbourne and I'm attending this conference, and she said, why should we put any money to help them? If they decide to take drugs, why not just let them, So I think we have a lot of work to do. Actually, I know we have a lot of work to do. My first encounter with harm reduction is when Sabina and I actually went to Portugal, and we were taken to have a look at the programs that they have there, and that's how we both joined Unite. And even when I left the Health Committee, I continued going around the world with Unite and meeting other members of Parliament and partners. So for me, where are we? And how do we support the people that use drugs? I operate a fund as a woman representative of about $60,000 per constituency per annum. And I try and serve everybody. So, of course, after coming back from Portugal, I found out that we have 2 harm reduction centers in my capital city of Nairobi, one operated by the devolved government, the county government of Nairobi, and one by the national government in a referral hospital for mental health. I visited both harm reduction centers, and it was disheartening to hear that, you know, we come here, we get the methadone, we get the treatment, but we trek such long hours, and we don't get food, the tablets, the interventions that we get, the medicines that we get are really harsh on the stomach, and if we don't have enough food, it's more harmful than doing good. And then to walk all the way back, you know, and if we do get transport allowance from some of the civil society, then of course we have a choice on whether to use the money for food for our families or to pay for the transport. Then another problem, of course, we have a huge problem with unemployment in Kenya. And that was a problem that they had. How do we get jobs? Who will employ us? We don't have any qualifications. So we decided to do a sample pilot. We took a few of them to driving school. We had others go for carpentry. We bought them tools. But it's, I mean, I can't even say it's a drop in the ocean. It's not even a drop. It's just atmosphere. You know, it's nothing that is of impact, you know. We have a problem even employing graduates. You know, people who've been tamarking for years that have got PhDs, masters, and they can't get jobs. So unemployment becomes a big issue in our region. And then you've got the community of drug users, you've got the community of LGBTQI, you've got the sex workers. These are key populations that we need to look into. And right now, we're in a dangerous spot. We're in a dangerous spot because I recently sat with an MP. We had a meeting, and I stood up again and talked about my views on LGBTQI and the human rights. And this fellow member of parliament told me, if I had my way, I'd kill all of them. And, you know, and I was sitting there next to her, and I was thinking, but I mean, why? God doesn't like them. I said, but the Bible says, thou shalt not kill. So I said, aren't you lost? You know, I don't know. I don't know why people start using God in such a bad way, because at the end of the day, I haven't received any memo from God saying he needs any help from anyone. So a lot of work needs to be done. I'm proud of Kenya in the sense that with its partners, it's been able to at least operate over 10 harm reduction centers. I'm proud of Bernice here and Vocal and all the CSOs that are represented here. They found their way here. They're good, amazing voices. And I said, let's put ourselves in a group. Let's work. Let's get the harm reduction bill a reality. Let's get the county governments to actually, you know, I wasn't sponsored by government. I think Sabina's here, courtesy of the Kenya government. I was told there was no budget. That's the advantage of being in bed with the government. I'm not yet there, and that's why they're trying to take the seat of minority whip, because they feel, you know, you've already jumped camp. But that's politics of Kenya. I'm like her. I don't support the demonstrations because I think we're in a bad space as it is post-COVID. We don't need to create turmoil. We need a government that works. And I can see everybody celebrating what's going on in Sudan and saying, hey, you know, here we come. So we do have a problem. I believe that we should celebrate the gains, the wins. I went in Elton John Foundation. I want to say thank you very much. I went into the movie theater this afternoon and watched quite a few of the films that you've put together, and I suggest all of you really find a chance to catch one of the films, because they really give the stories. In the previous panel that I was in, there was a discussion on what do we need. We need numbers. We need to actually quantify the numbers, and that's the biggest problem. We don't have data, and UNODC is not having enough. And I think Bernice and I are going to create some public participations where we call them and try and get some data. Then the next thing you need is emotions. You need to rise people's emotions and get them to feel the pain and the pinch of these people, their families, they're Kenyans just like us. And then, of course, we need to do research. But all in all, we should not tire. The fact that we made it here and we're part and parcel of this conversation, I think you should give yourself a big clap. We've got a lot of work to do. Let's leave this world a better place, and let's leave no one behind. Thank you very much, and God bless you.
Thank you, Esther. So as we go into the questioning time, we are going to take all questions, I think at once. Yeah, then each panelist is going to choose, or you can direct your question to a specific panelist, and then we go in around. Thank you so much. Yes, Wangari.
My question goes to... okay, so thank you. My question, I'm Wangari Kememia, I'm from Kenya. And my question goes to anyone who would answer this, but maybe the politicians in the House. Honorable Persists, you just said that the bigger problem we have is poverty, unemployment, homelessness, which is not only a problem of people who use drugs or women who use drugs. And I understand, I'll not ask us to go and ask government to do something special for our population. But I'm just wondering why we are not using this narrative for advocacy, like pushing in Parliament, it is poverty being punished. Because we have people who are LGBTQI in the uplands of Nairobi, but nobody touches those people. So I'm thinking this is something we could write on and let everyone know, even those, the members of Parliament who are all over saying about LGBTQI, people who use drugs. So I'm thinking it's a narrative we can use because it is poverty being punished. It is the poor woman in the streets of Nairobi who will be arrested by police. People are injecting drugs in Karen and the high places in Nairobi. So I still feel it's something that we could use and we have not used enough. I'm just wondering, for the members of Parliament in the House or even the other advocates, are we using that to push enough to make people feel guilty and realize that, don't tell us you're so moralistic, go to those big places and arrest people who are injecting drugs. We know politicians who use drugs, but nobody, they even say openly, I use drugs, but nobody touches those people. So my main concern is I don't feel like we are bringing out this strongly enough to make them know, we know you are hypocrites. You are actually punishing poor people.
Thank you, Wangari. Do you have another question?
Thank you. I'm Stanley from Uganda. From this session, also mine goes to the politicians. As the community members, the donors, I think we have the will to promote the rights and also ensure that we promote good health for people who use drugs and inject drugs. But we found a challenge that we've talked about the issue of money. It's true we can have donors who can give us money, but if the law cannot allow us to use that money, we cannot use it. I can give an example. In Uganda, we have the Narcotic and the Psychotropic Act. However, if someone is supporting something that promotes drug use, you can be taken into jail. In this case, I would bring the example of NSP. NSP, it is taken as a promotion of drug use in Uganda. So we cannot write anything about NSP. We cannot do anything about NSP because we are considered to be what? Promoting drug use. The same thing as the ministry, that we don't have people who injecting drug users. Why? Someone in the ministry is part of the government. How can they accept that we have injecting drug users, yet the law does not accept people to use injecting drug use? So we've had donors willing to support us with NSP, but since the government cannot allow us to distribute and share to the community members about NSP, we cannot do it. One of the parliamentarians told us that we should use numbers. What we've seen is that even the data as we, the community members, can gather, if it is not validated by the government will not accept the data that is generated by the community members. So you find it hard to create a case. Recently, we are trying to, it was a one-on-one with one of the lawmakers, and I was trying to share the importance of harm reduction programs. And the comment he made that, don't you think that you're in the wrong field? So if people still have such mentalities that drug use is not a public health issue, how shall we go about it? Yet the laws and the lawmakers are not believing in the problem that is existing.
Thank you. Next question.
All right, just for the expediency of moving the mic, I can go next.
Yes, thank you.
My name is Kiriba Karaoke. I am a legal practitioner who actually put together Vocal's thoughts and drafted that legislation that Mheshimiwa is going to be pushing through the National Assembly. And I think mine is a twofold question and, of course, a draft suggestion. We are in the process of formulating these policies that, of course, we understand as laws are made for us. They'll keep evolving and keep growing. And that's something that has really come out in this particular process. So my initial question is, from a people-centered perspective, the problem is here with us. We cannot keep running away from it, and we can't keep expecting and waiting that up until the legislation is in place is when we'll have formidable solutions. And in the process of coming up with that particular legislation and working with the communities, the main question was, what happens to us in the event that the donors pull out? What happens to us in the interim? Right now, what would be a short-term win? And that's when we get into the process of, is it possible for you to give us a commitment to actually place forward an authentic attempt to put in place fiscal strategy? We're currently in the budget-making process of the next cycle for our government. Is it possible to input something in that particular process that gives a small anchorage to the process of harm reduction service provision in the interim as we wait? We understand that's a very volatile conversation back at home from a traditional concept, our own understanding of the issues. That will take time to establish this framework, just the policy framework, and then moving towards the institutional framework, capacity strengthening, equipping them, training them, everything will take upwards of the next 2 political cycles. So what would be the interim measure that we can actually put in place to ensure that there's something, some semblance of anchorage of relief and support to the communities in the interim, but with the government backing? Because right now, if our global partners pull out, Ted will tell us whether it's possible to keep sustaining the harm reduction services in all those drop zones, in all those harm reduction centers. Is the government making any commitment to the extent of we can actually have something for them in the interim period as we move forward? Thank you.
Thank you, Kiriba.
Kindly allow me to stand. My name is Ted Wandera. I work with an organization known as the Caucus on Harm Reduction and Drug Policy Reforms, which is a platform that brings together drug policy advocates. Vocal are members of the caucus. So I just want advice from our 2 legislators, because as Wanja said, there is legislation now that has currently been tabled in Parliament on the criminalization of same-sex sexual relations, and we've had this law before, but it's not as detailed as it is right now, because it'll criminalize funding, it criminalizes gender aspects that have never been criminalized before. It criminalizes even speaking about, in Parliament, there was a motion in Parliament the other day, just all publications speaking about same-sex sexual relationship should not be used. That includes also documents from the Ministry of Health. So my worry is, today it's the LGBTI community. Quite recently, we made such wonderful gains with the 2 legislators here when the Narcotics Act was passed, and we had good gains on provision of harm reduction services where they're decriminalized. But my worry is the government has worked with the LGBTI community for so long, and now there's this big shift. What says that the government won't turn against the drug users next? We can't sit and just say it's those guys right now, right? And with Wanja's discussion on intersectionality, my worry is as soon as that bill passes, we might be the next target, and people will die. When it comes to issues around drugs, people will die. That's my biggest worry. So we just want a piece of advice, because we're going into full war. I won't lie to you. Full out war with Parliament on this. So we just want your advice on how we can go about it. How we can go about it. Just who should we target? Who should we target? What should we do? Just want to pick your brain on that. Thank you.
Thank you, Ted. There's another question here.
Thanks. I'm Darwin Nell. I work in Soweto, city of Joburg. We work with men who have sex with men. And it's exactly the point of intersectionality. And I just want to table, because I don't think it's very stigmatized, it's very hidden, both in mainstream drug programs, if there's something like that, and mainstream LGBT work, is the issue of sexualized drug use that you get among MSM, very poor MSM, but also surely in terms of sex workers. So yeah, the point is just that we take this specific group into account in our advocacy and our programming. And I also really like the first comment of like people, of course, have a hierarchy of needs, starting with food and security and moving up. And programs really need to respond to that. I mean, it's senseless doing programs about self-actualization, but people are hungry. You know, you need to cater for the hierarchy of people's needs.
Thank you. Is there another question, or we can? Okay. How are we going to do this? Esther, you want to answer first, then Sabina goes? You want to combine all the questions, or you want to go on the specifics?
It's already on? Okay. Wow, it's heavy. It's a workout. I haven't had lunch. Okay, so you know when you talk about hypocrites, you know the rich use drugs, but we target the poor. The same thing. We got quite a number of political leaders who are LGBTQI and they're in the closet. So yeah, and they will not speak up for the communities, and we know that they're there. You know, so that's the way it is. I think since our laws talk about public participation, one of the things that we've agreed with Bernice is that we're going to call a civic and try and get data, try and show that we have numbers. Because once we show we have numbers, and then we're able to tell the stories and show the emotions, right? And then the research. But I've seen that government doesn't really care when you tell them, oh, by providing a budget for harm reduction, you will save so much money on HIV infections or hepatitis, right? So in the long run, you'll save. I mean, if they actually listened to that concept of saving, then they would have released the guidelines on abortion way before the courts said release them on the JMM case. We were spending about $5 to $10 million on post-abortion care in our public hospitals. It was safer and cheaper to actually provide safe abortions, but nobody wanted to hit the guidelines. I think the problem we have is this holier and thou morality Catholic problem that we have. I mean, everybody all of a sudden has become a really good Christians. My goodness, I would hate to think of, forget what the LGBTQI do, but can you imagine what the heterosexuals are doing in their bedrooms? I mean, it's worse. It's worse. So, you know, here these playing saints, and half those men are probably having anal sex with their wives and their girlfriends. So here, you know, and when you talk about defilement and rape and all the sexual offenses, right now we're looking at the LGBTQI and we're thinking, oh, they're going to sodomize our boys, they're going to recruit our boys. My goodness, 200,000 girls got pregnant during the pandemic. Half of all of them under 18. Who was defiling and raping these kids? It was the heterosexuals. 85% of our population is heterosexual. If 10 or 15% are LGBTQI, believe you me, we're focusing on the wrong community. We need to focus on the heterosexuals and the crimes that they do. We need to get that message out there. All right? So I'm Satan's assistant. I'm lesbian. You know, hi, honestly. Okay, and I don't see what's wrong with that. If they think I am, you know, I actually said, bring it on. Is that all you got? But, you know, I'm the only one who signed the petition worldwide of parliamentarians telling Museveni, get real. Sometimes I think his son is a mad nut, but I think his son would be more supportive of us than he is. So maybe it's time that the son took over. So let's pray for that too. You know, he's a mad nut to crack. You know, when we're talking about what can we do now if the donors pull out, there's always that fear of what if the donors pull out. When we were in the health committee, I remember once telling Sabina that, you know what, we provide so little for commodities for family planning. And we're so donor dependent on family planning. What if they pull out, considering right now we have a situation that everybody's got problems back home post-COVID, right? I mean, we are under universal health care. I think there's a provision that government is doing for harm reduction. So the question is right now, how to get the county governments to starting off with Nairobi, try and improve and create more centers for harm reduction, know the numbers, and then put the emotional cases out there. And then once we've done that, we get the government to start doing it. I don't think we're going to need more money. We're just going to have to need a way, because government's saying we're in debt, we don't have money. We just need to find a way to twerk it round and get the government to be doing the things and seeing the sense of spending money on harm reduction on key populations to save money in the future. So it's a long process. It's not going to be easy, but all I can say is we've got a lot of work to do, right? We've got a lot of work to do, and we should not tire. It's not going to be easy, but karaoke, is it karaoke? Yeah. You talked about the law that we just passed, and you were celebrating that, we snuck in the needle syringe program. So the question is right now to make sure that we do a spot check and confirm that there are needles, syringes in the hospitals, and they are being used. I think social media gets people moving, all right? Sometimes I've noticed that government responds to abuse on social media, and that costs nothing. Let's just get on their backs, on social media, tagging them and telling them where they're going wrong and where they need to focus. I think we have to use that. When it comes to Parliament, I think right now the current president that we have, was installed by God. That's what they believe. So the God that they worship is now telling them that LGBTQI are sinful, and we shouldn't do it. But I can tell you one thing. We, in our Constitution, have the Bill of Rights. The judiciary has made a pronouncement, and the judiciary is not going to reverse. It's the Supreme Court that made that decision. This thing was a 10-year case on whether the LGBTQI can be registered. So the case is done. No matter how much noise they make, no matter what they do, the judiciary is going to stick to the law, and the law is they have the right to associate. The problem is we are dealing with this penal code that was colonial, and that is messing us up, and it's now we're not going to be able to move it. So what I think we should do is try and find a way to empower the community with employment, they're going to go underground to get their treatment. Because right now, if a member of parliament can sit next to me and says, why should we budget for HIV retroviral drugs for LGBTQI? Let them die. So this is a member of parliament. This is a representative of the people who basically is supposed to be in tune with the SDGs that says leave no one behind. But right now, everybody's got the memo from God. I haven't. So, let's just continue the fight. Yeah. It's a big fight.
Thank you. Honorable Sabina, do you want to say something?
Sign the petition. I'm lonely. I need another member of parliament.
Okay, I think for Esther has spoken a lot of things. I don't want to go back to what she has said. I wanted to just handle the issue of Uganda, and I think that's the only bit about the law. And I just wanted to tell you, in Kenya, we did our amendment of Narcotic Drugs and Psychotropic Substance Act. And one of the things that we did was looking at the issue of where the service provider, the ones who give the syringes, then they're arrested by the police for doing the same thing that we are trying to work on. And we did some amendment. Maybe you may need to borrow a few things, what we did on that act on Kenya, so that then we can be able to protect the ones who are service providers on this matter. I think that's the only bit that Esther has not touched. What I'll say, and especially in Kenya, and I know Esther is very passionate, I've seen her getting abused, I don't talk. Maybe I also got a memo. But the whole thing is not about the memo. There's the issue of the law and the implementation of the law. And as we said, if you are able to use the social media, because the law might be there, the High Court can pass whatever law they do, but the implementation is what matters. The same social media we are talking about can also be the same social media that can also bring down all the gains that we have had. So we really need to know how to balance the two, how to communicate and what time, and actually even who to use, because there are some people who are social media influencers that we can be able to use that will positively work for us. There's another method that we can use, and then we also lose all the gains that we have taken. So it's a very thin line. And As I've said, I've been following the matter, and I will not promise that it's going to be easy even when it comes to the floor of the House. I think there was a special motion by the member for Nyali that came on the floor of the House, and you could have seen it was fireworks. I would just say it was fireworks. So it's not going to be easy, but we can be able to use the social media influencers. We can know the right approach. And I always believe, when we said this issue of harm reduction, even when I was going to tell my speaker that I want to come, he was like, what is harm reduction? Yeah. Even for him to understand, something as basic as now we are talking about drugs and assisting, it was very difficult for him to understand. So we need to repackage ourselves and know then who do we target. Let's target if it's a speaker, if it's the members of parliament. We know somebody like Babu Owino, for instance. If you would say something, he has such a huge following. Let's see who our partners are going to be. Then we caucus and have a way forward. That would be my advice. But it's an agenda that needs to really be approached with all the care. I know for Esther speaks, she'll talk about abortion, she'll talk about everything, she really doesn't care. But also the population she represents, and especially in Nairobi, they would really go along with it. And like some of us who represent a population in the village, where you can even find your house torched, or all your cows, if not goats, stolen. Yeah, we all deal with different voters, and so we approach our matters very differently. But I believe there is a way out. It might be one step at a time, but we'll get there. Thank you very much.
Thank you, Sabina. Let me give the chance to the other panelists first, then we come back to you, Mheshimiwa. Julie, could you please share briefly, these are questions that were pre-recorded, could you please share briefly the importance of knowledge sharing between the regions in Africa?
I think, are we on? Can you hear me? No? Yeah? I can shout. No, we can use your arms. Yeah, I think knowledge sharing is really important. And I think there were two things that stood out for me today, and that was one, primarily this looking at funding opportunities. And I think we must never forget that knowledge is really powerful, that there is a lot of power that comes from sharing knowledge that can be done without access to funding. But I think in terms of what we've done a huge amount of with Sandput in particular, of advocating and getting information out into communities and allowing communities to share that knowledge more broadly amongst their peers. I'm also not a huge fan in the African context of webinars. I think it excludes far too many people who don't have access to technology, they don't have access to data, they don't have access to cell phones. I think it is very Eurocentric approach, and it's not something that works really well in Africa. So if anybody here is looking at rolling out knowledge sharing and education processes and training in South Africa, please really consider, or in Africa and our other regions, please really consider doing so face-to-face or in other models, but not necessarily through webinars. And then I think just in terms, one really key thing is that with knowledge sharing, you need to keep that contextual. And I know from what I've picked up here today, again, in Africa, we tend to be talking about harm reduction in terms of needles and syringe programs, in terms of OAT, of prevalence of methadone, whereas we need to remember that harm reduction itself is actually a set of principles and policies, and it speaks to stimulant use as well. It speaks to sex work, as was mentioned, and that we need to really start in Africa to enhance the understanding of what harm reduction actually is, and that it is more than just needles and syringes. And when we're advocating for harm reduction services, when we're doing any knowledge sharing around harm reduction in Africa, that we are speaking also to the people that are using stimulants, people that have alcohol use disorders, and not only focusing on opiate medications, and opiate services and injecting users. Does that?
Thank you, Julie.
Yeah. Thank you.
Mheshimiwa Persists, do you want to?
Yeah, I never thought about this until Sabina mentioned it. Babu Owino, Bobby Wine, and Malema are somehow like looking at themselves as the future leaders. Malema is very, very pro-LGBTQI, and he supports and stands for them and fights for them. So I think, we need to pay him a visit and tell him to talk to Babu Owino and get him on our side. So I think that's a good one.
Yes, Sean.
Delegation coming to Kenya in May, organized by the AEST delegation. And I think that's a tremendous opportunity as well to advocate for LGBTQI rights as well. They're looking specifically at harm reduction in prisons, but I think that there's a wider agenda that can be accessed there as well.
Yeah. We've got a very progressive PS for prisons, Mary Jason. But I tell you, to try and get any of these parliamentarians to come up and show up on a conversation on LGBTQI, the room will have chairs, but I'll be the only one.
We will mobilize.
Unless we call it something else.
Yes. Yeah.
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 Yeah, I think so. Let's just, like the KWOPA bill, the KWOPA meeting on harm reduction. We'll do another one for SDGs, and then we'll try and do one just on harm reduction. Yeah, we have to go this way until we get what we want.
Thank you, panelists. I think. We have another question. Probably the last one.
Hi, as a West African, I find gentleman from Africa put, what is the involvement of non-Anglophone speaking African country in this? What is the involvement of Francophones? What is the involvement of non-South, Central, East? What about my people on the West and the North? 'Cause this is fascinating, but it does not involve us. So, and when Julie said Africa, I love how we like to make the 54 countries a monolith. We're very different at all levels of morality. And, there's no Christianity in many countries that use. We go through tuberculosis, injection drug use is not what's an issue, it's more inhaling use. So there's so many disparities on what drug use looks like in our 54 countries. And then we talk about the continent. Again, what's happening in Kenya I find fascinating because even the political system is very British. Francophones don't have the same type of parliament, right? Colonialism, I'm listening to you, I'm thinking, okay, you guys are really British because those of us colonized by French people, that's not how it works, right? So I wanted to ask, out of the 22 countries, who's not on that side, and how do you work, and how do you plan on bridging that? Because for us to be better to know language is an issue, imperialism is an issue, colonization is an issue, religion is an issue, where we are on the spectrum of morality is an issue, and money, rich African countries react also differently, right? So.
Thank you. Banis has allowed me to speak in French.
Yeah, I've allowed him to speak in French.
Moi aussi, je viens d'un réseau francophone.
Well, we don't want to exclude the non-francophone speakers. Ça va me faire plaisir, but we want those who don't speak French to understand.
Good. So thank you. First of all, me too, I come from a French-speaking network. Burundi, we speak French. So you say what the involvement of French speakers networks. First of all, we have one representative sitting on the board of African Food, representing French speakers from Rafa Sud, Sandrine Koudou-Diaye. You can go to the website, she's come from Ivory Coast. And what we do, harm reduction speeches has been reserved as people speaking English. We have been able to translate some documents in French and distribute them through Rafa Sud. Rafa Sud is like an African food, but made by French speakers. And we don't have any problem, because even if we do trainings, we do both in the two languages. We have also Lusophone speaking from Zimbabwe, Mozambique, So we try to move those barriers of language. We speak same, because there's no heroin for French speakers or cocaine for English speaker. So there's no problem. We have now in the 22 countries. We have Senegal, we have Cameroon, we have Burundi, we have Mali and Ivory Coast, who are French speakers.
Thank you, Richard. I think also we should have, what we are aware of is there was a lot of visa issues with West Africa colleagues. Otherwise, we usually have very many community members and civil society members from West Africa. We are aware of our friends who were denied visa to come, so there's just nothing that we could do.
Can I just say, I get her point. Everything is in English. Yeah. I don't know if that's what I'm getting. Like, this workshop is fully in English. Where are our francophone colleagues? That's what she's saying.
You didn't get the visas.
Yeah.
I came from Canada.
Yeah.
There's a discrimination.
There is.
Discrimination for anyone applying for a visa from Mali, Guinea, Senegal, automatically you're rejected.
It happened even in the AIDS conference in Canada.
We hosted
Yeah.
We were part of the team hosting the AIDS conference in Montreal. I
Yeah.
didn't go. I boycotted.
Yeah.
I hosted the event in Montreal. As an Ivorian, I didn't go. Because I have a double passport, I was able to go. It makes no sense.
But just to assure you, there are networks of people who use drugs in West Africa. We have held an East Africa Harm Reduction Conference, and we invited everybody. And I know there's Mustafa Mbonj from Senegal. There are peer networks in West Africa that work together with Africa Food. But now when it comes to sessions like this one, these are things out of our control, and we are very sorry, but I think we need change everywhere. This is what we call structural discrimination. Thank you so much. So we will give our panelists 3 seconds each to round up as we finish up. I'll start with Wanja. 3 seconds.
I think 3 seconds are not available. They are not. Definitely, Wanja is a noisemaker. And I actually want to touch on that issue of Francophone country, because, to be honest, Francophone countries have been left out in everything, including in funding. So even being in this conference and we do not have language justice, for me, is not an excuse whether they are Francophone people or not in the room. Like, we needed to have translation for French speakers, for the other people who are present in the room. So I think this is something that we really, really need to have in mind, that there are regions that have really been left out, and Francophone in all the populations, actually. And that's why they did not make much noise in Montreal. But Anglophones were there. We were there with placards. Anyway, my 3 seconds starts now. So, what I wanted to talk about, and it is this issue of criminalization. And thank you so much, Ted, for bringing that up, because yes, today they are coming for LGBTIQ. Tomorrow they will come for people who use drugs. And they will actually come for the criminalized populations at once. Trust me on that. The thing we need to deal with is those people that God is speaking to. That is our main problem. There is so much money being invested in Africa to criminalize populations. We need to track this money. We need to track these individuals. We need to make them accountable. We need to put those governments, the US, what's the president in the US? Like, we need actually to tell them to keep their people in the US, and they should not come to destabilize Africa. These so-called family protection bills, it's a well-curated project. There is no way Uganda has passed a bill, Kenya is passing a bill. Tanzania, we have gay people arrested and jailed for 30 years, and Burundi, we have 17 people in detention. All of them are gay men. It is a whole curated project. So I think for me, even as we talk about these issues of drug, and I'm so happy to see Sean here, because I think he's been doing a lot of research on that, tracking these forces that are actually pushing for discrimination, that are pushing for these systems of oppression for communities of people who use drugs, for sex workers, and for the LGBTIQ persons. Thank you, Madam.
Thank you, Wanja. Thank you. Mheshimiwa Pasaris.
No, I became a politician because I was a social entrepreneur doing a business to light up Kenya. And then I started being fought by politicians, and I couldn't understand. I'm doing something good for the country. Why are you fighting me? So that's why I decided to get into politics, because I was inspired by JFK's ask not what your country can do for you, but what you can do for your country. In all of you, the civil society that I'm sitting here with, it's time. It's time to get into government. It's time to identify the seats that you need to go for. And it's time to get mentored to become politicians, because we need that other voice. If we're going, the electorate is the leaders are a reflection of the electorate and vice versa. So if we're going to have a lot of resistance in everything that we want to do, it's because we are allowing the electorate to bring in the bad leaders. So we got to change the electorate and at the same time change the leaders. So I really want all of you to consider getting into there, because that space is getting very lonely. I'd like to see a few of the people that have memos from God exit, so that I can have the ones that don't have memos from God working with me. But all in all, I think we've got a lot of work to do. I no longer call myself a feminist. I call myself a humanist. Thank you.
Thank you.
Hi, thank you. I'll just keep it short and sweet. And mine is just to everybody, regardless of what country you're from, is please just do not forget about the rural populations, rural and remote people. They are also heavily stigmatized and discriminated against, particularly with regards to substance use or alcohol use disorder. So please, in any policies that you're working on or addressing any activism and campaigns, please don't forget to include the rural and remote populations. Thank you.
Mine is it's a discovery that I just made today when Wangari asked a question about punishing the poor people. And Esther, your answer was, they don't care about the money. And I remember, Uhai, you had a workshop, and there's a question that you kept asking us about the power over and power within, and I remember us just going through that. And I think what I've discovered is just the government's power is in the people, just as the Constitution says it. So this is where we're supposed to be lobbying the people. It doesn't matter if you bring logic into it and explain how you'd save more money going this side by this other side. If the people say no, as Sabina also said, her people will ban you and take your goats and and your cows and everything. If the people say no, then it's a no. If the people say yes, then it's a yes. So the media and just trying to lobby the people would be the key for our movement.
So thank you everyone for the floor. So let's work for the criminalization, because this is our culture. Taking drugs is our culture, and drugs are very good. This is the time. And also, decriminalization if we end criminalization, will enable many people to access to health services, to have more power, individual who can contribute to the development of our country. So legalization, decriminalization, as a new revolution. Thank you.
Wow, I just want to say that it's important that we keep on exchanging ideas. I think already from this discussion, we've learned something new. Let's see where different approaches will work. Let's not reinvent the wheel, where we're able to borrow from each other and different countries on what can be done. And before the civil society, before you all come to Parliament, as Esther has asked you to, let's use the people of goodwill who are already there. Before we do the next election in Kenya, to be the next 4.5 years to come. So for now, what do we do? Let's work for the best. Let's do what we need to do now and not tomorrow. So myself, I again want to offer my support and in the best way that I can. And I know myself with Esther and a few other colleagues, we've already met all the women members of parliament in my parliament, and already the SDG group. We are going one step at a time. As I said, it might not happen overnight, but the conversation we are having today is not what we had yesterday. Things are changing. So let's be positive. Let's keep on fighting, and we can't give up the fight. Thank you very much.
Thank you, everybody. Thank you for coming. Thank you for listening. To continue this conversation, Sean is having a session tomorrow on imperialism, where the money is. And Wanja will be talking about intersectionality and participatory grant making tomorrow at 2 p.m. See you there. There is